afternoon and evening, Excellencies, Member State delegates from around the world and here in Geneva. Thank you very much for joining us today for this information session on COVID-19. We will have 4 presentations today. The first from Her Excellency, the Minister of Health from Nicaragua. That will be followed by 3 presentations from the Secretariat. Epidemiological update from Dr. Babatunde Olawokare. An update on the Review Committee of the Functioning of the International Health Regulations, IHR, during COVID-19 from Dr. Carmen Dolea, and the launch of the Score for Health Data Technical Package by Dr. Samira Asma, the Assistant Director General, Data Analytics and Delivery for Impact. But before we start, as always, it's my honour to give the floor to the Director General for his opening remarks. DG, the floor is yours.
Thank you, Tim. Honorable Ministers, Excellencies, dear colleagues and friends, thank you for joining us for this week's Member State briefing. As we have a full schedule today, my remarks will be brief. And before I get into today's briefing, I would like to start with some wonderful news. This Tuesday, we announced the certification of the eradication of wild polio virus in Africa. This extraordinary achievement has only been possible because of the determination of the people and governments of Africa and the many international partners who played such vital roles in working with WHO on this achievement. In particular, I would like to acknowledge the many member state donors who invested in making this possible, including Australia, Canada, France, Italy, Germany, Japan, Norway, Russia, Saudi Arabia, Spain, the United Arab Emirates, the United Kingdom, and the United States of America, as well as the European Union. Since 1996, almost 9 billion polio vaccines have been delivered in Africa. Up to 1.8 million cases of wild polio have been averted, and up to 180,000 lives have been saved. The investments we have all made have not only helped to end polio, they have also helped to strengthen health systems, providing vital infrastructure and health workers to respond to other crises, including Ebola and COVID-19. The end of wild polio virus in Africa is a momentous achievement that demonstrates what's possible when we come together in a spirit of solidarity. The same spirit of solidarity between nations is essential to bring the COVID-19 pandemic under control. Today, we have the pleasure of welcoming back the Minister of Health of Nicaragua, Her Excellency Dr. Marta Reyes Alvarez, to discuss her country's experience with regards to sentinel surveillance of respiratory diseases. Next will be a presentation on the epidemiological situation from my colleague, Dr. Babatunde Olawokure, WHO's Chief of Information Systems and Analytics. This will be followed by an update on the Review Committee on the functioning of the International Health Regulations during COVID-19. That will be given by another colleague of mine and the ADG, Dr. Jawad Mahjour, the Assistant Director General for Emergency Preparedness. The Review Committee has been established in accordance with WHO Resolution 73.1 and the relevant provisions of the IHR. The committee will make technical recommendations on the functioning of the IHR, as well as regarding possible amendments. This is the 4th time a review committee has been convened under the IHR. The chair will be elected at the first meeting on the 8th and 9th of September 2020. The review committee will interact as needed with the independent panel for pandemic preparedness and response and the independent oversight and advisory committee of the WHO Health Emergencies program. We will provide regular updates on the progress of the committee's work to member states over the coming months. The committee may present a report at the 74th World Health Assembly in May 2021. Our final presentation will be from Dr. Samira Asmas, and Director General, Data Analytics and Delivery for Impact, who will brief us on the launch of the SCORE for Health Data Technical Package. As I mentioned last week, this is an innovative effort to strengthen member state capacity for health information systems and to generate timely data that can help us improve country health outcomes. Thank you once again for joining us, and I look forward to the presentations and your questions. I thank you.
Thank you very much, Director General Tedros, for your opening remarks. It is now my honor to give the floor to Her Excellency, Dr. Marta Reyes Alvarez, Minister of Health from Nicaragua.
Buenos días a todos. Muchas gracias. Reciban un saludo de nuestro Ministerio de Salud. Nosotros vamos a abordar el día de hoy la experiencia de Nicaragua en relación a la vigilancia centinela de enfermedades respiratorias. Para nosotros en nuestro país, el desarrollo de la vigilancia centinela.
The Sentinel surveillance system has been very important, and in this period we have implemented some. One was in 2004, which was for first-line anti-malarial drug resistance, and then in 2010 we set up with the rotavirus surveillance on children under the age of 5 and Sentinel surveillance for pneumonia and bacterial meningitis. And these are linked directly to the introduction of the vaccines for these illnesses. And then in 2011, the global alert for avian flu H1N5 established the Sentinel surveillance for influenza and acute respiratory illnesses caused by bacteria and other viruses. And in 2019, we carried out and started the entomovirological surveillance on mosquitoes to detect this dengue serotype which was circulating in mosquitoes. It's very important that we look generally at severe acute respiratory infections, and we've set it up in this way. We set it up for the SARI, and we also looked at ILIs, influenza-like illnesses. And we looked at bacterial pneumonias and the viral etiology of SARIs in children under the age of 5. The Sentinel surveillance for the acute respiratory illnesses looks at all of these countries, and we also look at a district in Managua, the capital of our country. We also set up the surveillance of severe acute respiratory illnesses and pneumonias in all our country. And we're also looking at it in health facilities, public and private ones. On a country level, we have set up 3 Sentinel unities, which are in 3 departments of the countries in various territories. So they are representative of different areas so that we can ensure that our Sentinel surveillance is covered properly. We have Managua, where we have 2 hospitals in the capital. Then we have Esteli and Masaya. So Masaya has 1 hospital and Esteli has 3 hospitals, and also through 2 departmental hospitals and 1 health center. And this was the first part of our surveillance, where we were looking at the level of the units, whether they're primary or health centers. So we looked at the type of hospitals. We wanted hospitals that had more than 50 available beds. We wanted hospitals with pediatric and internal medicine departments, and we looked at the number of discharges for severe acute respiratory illnesses. We looked at hospitals that had to have radiology services, a clinical laboratory or laboratories for virology and bacteriology, and we needed a hospital epidemiologist to be present, and we needed an institutional commitment to maintain this surveillance. We'd like to present this because we wanted to see how our surveillance is working and to share with other countries the distribution of the surveillance and the behavior of influenza and other viruses from 2018 to 2020 and the impact that it has had on our actions within the country. So in 2018, we can see that influenza and other viruses, it becomes more acute from week 31. And in 2018, we had a prevalence of influenza, and by week 33, we could see the presence of H1N1 influenza and other respiratory illnesses and different types of influenza. And then in the next picture, we can see the type of influenza by type and subtype, and we can see the established presence of the H1N1 influenza, and then we have influenza B and a little of an influenza A. In 2019, we can see more or less the behavior of the respiratory illnesses that take place at the same time of year, and we can see that in this year the prevalence was mainly of para-influenza, and we had aspects linked to type A non-subtypified and influenza B. We can see that in the distribution on the graph, where we can see that we have H3, which is the most important one, and then we have H1N1 and some influenza type B. And in 2018 and 2019, we can see these pathologies, which is between 150 and 170 on a weekly basis. And the situation for the influenza viruses in 2020, when we compare the H1N1 with COVID-19 in this year, we can see that it's been displaced by the new coronavirus, the novel coronavirus. So we could identify particularly if we look at the influenza chart by type and subtypes, we can see that in 2020 the behavior is very different on a weekly basis, on an epidemiological week basis. We can see A non-subtypified and influenza B and H3 and H1N1. And then we can see that the way these have changed when we compare to the COVID-19 and the coronavirus virus. So what we really wanted to do was to show the importance of gathering information, but the surveillance that should be in a complete and comprehensive manner. This has helped us to identify the viruses that are circulating and the appearance of new viruses, and it's really assisted us in early detection of changes of acute respiratory illnesses and pneumonia, so that we can establish measures to intervene and mitigate and control. It helps us also to know the types and subtypes of virus and bacteria that are circulating, and this helps us to set up a timely, suitable and clinical approach to the cases. And we've also, through the Sentinel surveillance, been able to understand and measure the impact of actions and establish the most efficient strategies. And our family and community health model has allowed us to continue providing assistance to the essential programs, including COVID-19, so that we can face the challenges for our country. Thank you very much.
Thank you very much, Your Excellency, Minister of Health from Nicaragua, for your presentation on the Sentinel surveillance system for respiratory diseases in your country. Now it's my pleasure to introduce Dr. Babatunde Olawokure for the epidemiological update. Babatunde, you have the floor.
Thank you very much. Honourable Ministers and Excellencies, I would like to present to you now an overview of the COVID-19 pandemic globally. And from the outset, if we have a look at the first graph, which shows the global situation, what you can see here, and I will have the next slide will show a little bit more detail so we can disaggregate the different colors. You see really that while we have increases in a number of countries spread across the world, there is also overall apparently a downward trend. So if we look at the various member states on the right, so you can see different member states in different colors. In general, there is an overall downward trend in the number of cases that have been reported. We are looking at this stage at around 23.9 million cases as of 10:30 a.m. on the 27th of August, just to give you an update on the numbers that you're seeing there, as well as 820,000 deaths approximately. Now, when we look at the epidemic curve by region, what we can see here is clearly AMRO is fluctuating quite a bit, and there is really there's been a decrease, but we're seeing a very slight increase in the trend. Euro appears to have stabilized, and then Sierra still looking as an upward trend with regards to the number of cases that have been reported. Emerald and Afro very clearly showing downward trends, but what we also had with Wipro is again some fluctuation, but a clear stabilization, but looking upward. But when we take all of this together, we see that we have a downward trend in the number of cases. And this will be shown now when we look at the geographic distribution on various maps that we have. And the COVID cases reported in the last 7 days, my apologies, we can see here that there are, most of these cases are coming from the Americas. We're having less cases from Europe and from Asia, as well as from Africa. And then this point is really driven home when we look at the percentage change in COVID-19 cases over the last 7 days. And we're seeing a lot what I would call cooler colors in terms of the yellow, which shows the limited change happening. And so that's quite a small range, maybe indicating more stabilization. But with the blue colors appearing a little bit more, and therefore showing that these countries or member states are experiencing a decreasing trend. And so we have very few member states now with red and orange indicating increasing trends over the last 7 days. And this really is my last slide here. And this one actually shows again the number of deaths, percentage changes in deaths over the last 7 days. And again, the cooler colors predominating here with yellows and blues showing the decrease in the number of deaths. And it's just a few highlighted member states with red colors indicating a continuing increase in the number of deaths over the last 7 days. So overall, a decreasing trend in regions, but with various member states having a number of, various regions having individual member states who are continuing to show an increase in cases. Thank you very much.
Thank you very much, Babatunde, for that very concise epidemiological update. As per usual, following the 4 presentations today, there will be ample time for member state questions and answers. It is now my pleasure to introduce Dr. Jawad Major and Dr. Carmen Dolea for an update on the IHR Review Committee. Jawad, you have the floor.
Thank you, Tim, and thank you, DG, for introducing the IHR Review Committee. And as you heard, the Director General have decided to establish an IHR Review Committee in line with the Article 50 of the IHR, the International Health Regulation 2005. And this, of course, based on the request of member states included in the board had Assembly Resolution 73.1, where the member state asked the DG to establish HR committee to look at the functioning of the HR, and this is the context we are establishing this HR committee. My colleague Carmen Doria will take us through some slides to present the background, but also the technical areas that may be discussed and some idea of the timeline. Carmen.
Thank you very much, Jawad. Good afternoon, good morning, good evening, honorable ministers and delegations. As mentioned, the review committee, this is the background as you heard already. The review committee is established under the IHR by the Director General in accordance with the provisions of Article 50 to make recommendations to the Director General with regards to amendments to the IHR or any other matter referred to it by the Director General. As you know, so far the review committee has been convened by the Director General of WHO on 3 occasions. One after the pandemic influenza H1N1 in 2010-2011. The second time for the second extensions on establishing the IHR core capacities under the Annex 1 of the IHR in 2014. And the third one after the Ebola outbreak in West Africa to review the functioning of the IHR during that outbreak. For this review committee, as was mentioned by Dr. Jawad Majloub, the mandate for convening this committee comes from, as you recall, the resolution WHA 73.1, specifically in operative paragraph, subparagraph 10, which requested, as you recall, the Director General to initiate a stepwise process of impartial, independent, and comprehensive evaluation, including existing mechanisms. And these mechanisms include the IHR Review Committee and the Independent Oversight Advisory Committee for the Emergency Program of WHO. To review experience gained and lessons learned from WHO coordinated international response, including the effectiveness of mechanisms at WHO disposal, specifically the functioning of the international regulations and the status of implementation of relevant recommendations from previous reviews committee. And you have in the slide and of course in the resolution the rest of the paragraph. I will not go through it in the interest of time. As mentioned, the scope of this review committee is focused only on the functioning of the IHR during the COVID-19 pandemic, with specific references to the IHR relevant provisions related to but not limited to these 6 areas, but there may be more. So these areas include outbreak alert, verification and risk assessment, information sharing and communication, international coordination, including possibly the review of the role of the national IHR focal points, the emergency committee's working procedures, and modalities, including the need for an intermediate level of alert beyond the binary nature of public health emergency of international concern or not, the additional health measures implemented in relation to international travel, the core capacities implementation and possibility of establishing a peer review process to assess progress in implementing these capacities, and of course progress made on the recommendations from previous review committees. A couple of words about the membership of the committee. In accordance with the procedures of the IHR, these members are selected from the IHR roster of experts, established under the IHR as well, or other expert advisory panels, and they are bound to have a broader mix of expertise, balanced geographical and gender representation from both developed and developing countries. The review committee members are not WHO staff. In that capacity, they may not request or receive instructions from any governmental authority external to WHO. A couple of words about the conduct of business as well. The committee will work through closed deliberative sessions to allow for candid, extensive discussions and deliberations and drafting of reports, but also open session, as you see, where the Director General invites member states, UN, United Nations representatives, and international non-governmental organizations in official relations with WHO to designate representatives to attend the committee. These representatives shall not have the right to vote. Lastly, the review committee will provide its advice to the Director General and shall submit its final report to the Director General, who will communicate the views of the committee and its advice to the Health Assembly or the Executive Board for their consideration. And the last slide here, a little bit of the timeline. This is going to be very short period of time and very intense process between now and the milestones for the governing bodies meetings of WHO. The committee, as was announced, will start on 8 and 9 September. The 9th September will be an open meeting. In between that and the resumed session of the WHA 73, when that will be decided, there will be deliberative sessions of the committee, closed sessions, and if depending on the progress, there will be potentially a report made probably by the chair to the resumed World Health Assembly. In between these times, as was mentioned as well, there will be discussions between the different review panels that are established in accordance with this mentioned resolution. And then there are the time milestones, as mentioned, about the Executive Board in January and May in 2021. Depending on progress, the review committee will submit either reporting through the chair or formal report if they finish the work to the World Health Assembly in May 2021. Thank you very much for the opportunity, and hand the floor over to the chair.
Thank you very much to Carmen and Jihad for that presentation on the IHR Review Committee, and particularly interesting the timelines looking forward. Now my pleasure to introduce Dr. Samira Asma, the ADG for Data Analytics and Delivery for Impact, to present on the Score for Health Data Technical Package. Samira, you have the floor.
Thank you, Tim. Good afternoon, Honorable Ministers, Excellencies and colleagues. We cannot overstate the importance of data to track the course of the pandemic. We are all experiencing the challenges highlighted by the data gaps, which often hinders our ability to respond in a timely manner. Lack of timely, reliable data makes it hard to track progress and even harder to fight the pandemic. It is difficult to assess the true extent of the direct and indirect impact of the pandemic globally, and it is even more difficult in low-resource settings. In May, World Health Statistics report this year that we launched, we highlighted that a number of countries lack data for more than half of the health-related SDGs. And we have highlighted in the WHO's GPW13 results framework the importance of addressing these data gaps. And as part of our commitment to strengthen health information systems and improving health, especially in the context of COVID pandemic, we are very pleased to announce to you the launch of the SCORE technical package. SCORE is a technical package of essential interventions, recommended actions, tools and resources that aim to support countries in addressing challenges and in meeting the health information system's needs. It represents for the first time in a single harmonized package all the key elements to enable governments to address data gaps, invest in scalable solutions, and take informed policy decisions. As Dr. Tedros often says, we cannot make progress without measuring progress. The World was already behind in meeting SDGs and the triple billion targets, and COVID pandemic has set us back even further. It also threatens the loss of gains we all have already made. We are now only 10 years away from 2030, and the window of opportunity is rapidly closing upon us, and we cannot wait for another 10 years to fix the data gaps. To keep us on track, we need to keep score to save lives and promote health. I would also like to point out that COVID-19 has also surfaced the serious inequalities in terms of access to care and the disproportionate number of deaths occurring in disadvantaged groups. We need disaggregated data to enable targeted interventions and to close the gap in inequalities. SCORE addresses these gaps through 5 key areas: survey populations and health risks, count birth, deaths and causes of death, optimize health service data, review progress and performance, and finally enable use of data for policy and action. Each of these interventions include key elements and indicators with examples of actions countries can take. Surveys are the cornerstone of public health for monitoring health trends and determinants. Surveillance is not only data collection, it is the ongoing systematic collection, analysis, interpretation of health data, essential to planning, implementation, and evaluation of public health practice. And here's an example of GovData tool for health emergencies. This tool is designed to manage complex data in disease outbreaks through contact tracing, rapid data entry, visualization and data exchange and more that countries are already using. Counting births, deaths, and causes of death is the foundation of informed public health decision making. Without this critical information, we will not be able to report on SDGs, prioritize policy actions, and guide investments to improve population health. And this is an area that needs particular attention. Majority of countries are unable to report on deaths and with quality reporting on causes of death. We launched the Rapid Mortality Surveillance tool to provide a more complete picture of the true impact of COVID by accounting for deaths that occur both inside and outside healthcare facilities. This is indeed a challenging area, but we thank you also for your support to submit weekly reports on certified deaths through the dedicated portal that has been made available to member states. And we stand by to support our member states. Optimizing health services data to assess quality of care, ensure equitable access, and build healthcare workforce capacity is vital. This includes regular health facility surveys, routine health information system reporting, and data on equity, workforce, access, and quality of care at all levels, especially primary health care. Here's another example. The HERAMS, the Health Resource and Service Availability Monitoring System, is an example to track services and resource availability during emergencies that can help swiftly identify needs and gaps to plan and respond effectively. Using data to conduct regular performance reviews in countries with a focus on equity and institutional capacity for analysis and learning. These reviews help countries guide investments. As you know, we launched the GPW Triple Billion Dashboard, which is accessible to all member states to track progress towards the SDGs and the Triple Billion targets at global, regional, and country levels. By providing targets, trajectories, and trends, this dashboard is a vital tool to actively problem solve and scale common solutions so that we can deliver on our promise to SDGs and the triple billion targets. Technical support is available in this regard to a number of member states through our regional offices and headquarters. Finally, and most importantly, enabling data use for policy and program action is critical to drive impact. This requires transparency, accountability, and a commitment to data sharing through country-led data governance. Global and national health observatories house WHO's official country-consulted health statistics and provides access for countries to review global, regional, and country trends and guide strategic policy dialogue. By providing a common understanding of progress towards the health-related SDGs and triple billion targets, we can be more strategic and informed in both our day-to-day and long-term priority settings. This technical package, we hope we will maintain to reflect the new developments and innovations, many of which are underway. Soon we will also be launching the assessment tool and the first ever global, regional, and country assessment status reports. We hope this will help governments benchmark progress against national and subnational priorities. You can find more information and download the SCORE Essential Intervention and Technical Package on our website, and please share any comments that you may have from the contacts provided below. And finally, SCORE is the launching pad for our roadmap to modernize WHO's end-to-end data systems as outlined in the transformation agenda. This is a request that member states had recommended WHO Secretariat to have a one-stop data portal. This will include dedicated country portals, one-stop data and self-service analytic portals, and a comprehensive data catalog based on a single repository. More information on this will be provided shortly, and we look forward to sharing further updates on this exciting new initiative. In closing, I would like to thank everyone who contributed to making SCORE a reality, including WHO technical experts, internal and external collaborators and partners. And a special thanks to our member states who have reviewed and contributed to this technical package. And I would like to thank you again for your time. Thank you. Over back to you, Tim. Thanks.
Thank you very much, Samira, for that presentation on SCORE for Health Data Technical Package. Now it's time to hand over to you, the member state participants, for any questions you may have for any of the four presentations today. Her Excellency, the Minister of Health, Dr. Marta Reyes Alvarez from Nicaragua, Dr. Babatunde on the epidemiological update, Dr. Jawad on the IHR Review Committee, or Dr. Samira on the SCORE technical package. It's my pleasure to ask Fabia, who will be helping moderate the session again this week, to assist in recognising member states who wish to raise their hands and ask questions. Please, if you have a question, raise your hand on the Zoom function and Fabia will recognise you. Fabia, any hands up? Over to you. Thank you.
Thank you very much, Chair. I can see we have one hand raised at this stage, that being from Sweden. So perhaps we can proceed with the question from Sweden. Martin, you have the floor. Thank you.
Thank you very much, and thank you so much for these presentations. Very helpful indeed. I have a question relating to a topic which was not raised here today, but launched on Twitter yesterday, and it relates to the Science Council. And I was wondering if we could get a bit of more information of what the purpose and objectives of this initiative is. So it's the Science Council that was introduced on Twitter yesterday. We'd be delighted to have some more information on that. Thank you very much.
Have a hand up from Ukraine. If we shall proceed with a question from Ukraine and then do another round to see if any third final questions before handing back to the Secretariat. Thank you very much. Ukraine, you have the floor. We can hear you, but quite faintly. We'll do our best to turn up the volume. Thank you.
Okay, thank you very much. Dear Secretary, thank you very much for this very useful presentation. Just not to take your time, one small question concerning the creation of this committee of review of IHR review. Just a small question, when exactly it was established? Because I didn't hear during the presentation. Thank you.
Thank you, Ukraine, for that question. So we have two questions just now. There's been from Sweden and Ukraine. First one pertaining to the Science Council, launched yesterday on Twitter. And second question on the IHR Review Committee and its establishment. If I may now hand the floor to the Director General, to Dr. Tedros, to respond to the first question. Thank you, Dr. Tedros.
Thank you. I will take the first one, the Science Council. As you know, this was part of the transformation agenda. As you also know, the focus of the transformation agenda was in strengthening the core business of WHO. One of course, the core business, the central business is norms and standards, and strengthening our capacity in our core business in standards and guidance is important, norms and standards. And that's why we have established the science division. And not only that, that's the first, and the chief scientist, again the first ever chief scientist in WHO. Then to complement this, as part of the transformation, we have decided to have an advisory group, which we called this time the Science Council, that will advise me and the chief scientist on science and help us to use the best tools. And we prefer to have the application advertised openly, so we can get the best scientists from all corners, so we can select from those scientists, and it's of course can be considered as one of the advisory groups, but this is a bit special because it's going to focus on the core business, and not only the science division or the chief scientists, it will be also supporting the three major pillars, because the core business revolves around the three pillars, which is the healthy populations, universal health coverage, and emergency preparedness and response. And based on the transformation, we have these three pillars, and the science division will work focusing on the three pillars and helping develop norms and standards. So this is the implementation of the transformation. I think our chief scientist, Soumya, is online. She can give you more on the council. And Soumya, please.
Thank you very much, DG, and thanks for that question from Sweden. Honorable Ministers, I think the DG has really laid out the rationale for having a science council, and I think this is a really important time to launch something like this, because the role of science and evidence and data is critical to inform not only the pandemic response, but to feed into all health planning, as Samira Asma just explained. So the Science Council really will be multidisciplinary, will advise the Director General and the WHO on the priorities, looking ahead, looking to the future, where the new scientific and technological advances are likely to happen, where we should be investing, where we can already start capitalizing on advances and make sure that we leverage those scientific advances to improve public health and to improve also clinical medicine, particularly those technologies which can have big impact in the low middle income countries. So we're looking for people with broad expertise, with a lot of experience at the national and the global level, and an interest in global public health. So that the endeavor is to link science with public health and to advise WHO, advise the Director General on the way forward, and also on what we are doing well and what they consider that the gaps are where we should be putting in more efforts. So we would really like to see very high-level applications, top applications, and hopefully in the next few weeks we will then begin the process of selecting these experts. Thank you very much.
And Ms. Mortality, I would like to ask you, because it's referring to encourage people to apply. Thank you.
Thank you very much, DG and Soumya, for those responses to the question from Sweden. Now to the question from Ukraine, I give the floor to Dr. Jad Major for that response. Jad, you have it.
Yeah, thank you very much, Tim, and thank you, Ukraine, for this question. The committee, the IHR committee was established today, and by good practice, the Director General preferred to announce to the Member State first before going public, and the committee will have its first meeting on 8 and 9 September, where the committee will agree on the term of reference, the area they're going to look at, and also the functioning mechanism of the committee. Meanwhile, the Director General will contact all Member States to nominate a representative to participate in the deliberation of the IHR committee.
Thank you, Jad. I'll now ask Fabio to have another round if there are other Member States with their hands raised wishing to take the floor. Fabio.
Thank you very much, Chair. I'm pleased to say we do have a few more hands up, and also wish to note that we have over 200 participants online, which is wonderful. So Canada, we can see that your hand is raised. I would now like to give you the floor. Thank you. Over.
To discuss among themselves, and of course, when the IPPR as overall response will go to overall response, including the IHR, but I don't think that the IPPR will go to the detailed discussion of the functioning of the IHR, and this is where the IHR committee can be very helpful in advising the Director General and through the Director General Member State on what need to be changed in the IHR to make them more functional. Over.
DG?
Since the IHR and the IPPR panel is also under establishment, still, they haven't met because they need to first finalize or complete the selection, the full members of the panel and also the IHR committee. Following that, our expectation is that they will agree on some modalities to meet and discuss on some areas that may be overlapping, or on making sure that there are alignments when necessary. So it will be up to them, of course, to agree on what kind of mechanism. But we believe that based on the resolution, that they will have a mechanism to communicate among themselves and to see how they can actually work where alignment is needed for alignment, and when overlap should be avoided, and for that and other issues, of course. Thank you.
Thank you very much, DG and Jawad, for those responses to the question of Canada. Now to Japan's question. We have Bruce Alwood here again today. Bruce, if you would like to take up that question, please. Thank you, Bruce.
Thank you very much, Tim, and thank you to Japan for the question. So in terms of preparations for the Council, the membership has been discussed between the Office of the Director General and the Office of the President of the European Commission, whom the Member States know were a key player in joining with the Director General and launching the ACT-A accelerator. So the date has been slightly adjusted. It will be the 10th of September to ensure the participation of both. The invitations are in process, an agenda is under process. We have member states asked about the TORs 2 weeks back. They're being finalized and written out. We're just going back and forth between us now. There are materials in development which will really be anchored in the progress to date, a report as well as plan for the next period, and an updated investment case. We're anticipating all of that will be, well, the first pieces will be finalized in the invitations over the coming couple of days and issued, and that the materials that I mentioned will be finalized probably just in a few days in advance. We'll make sure that the TORs are shared with all member states, as has been the request before. I will try and update you on those next week at next week's briefing. And also we will share the plan and progress as well as the updated investment case with all member states in advance of the meeting of the Council as well.
Thank you very much, Bruce. Back to you, Fabio.
Thank you very much, Chair. I'm not able to see that we have any hands up at this stage. If we could just kindly remind those member states that do wish to take the floor to please raise their hand in the Zoom function. Thank you.
If there are no more requests for member states to take the floor, I take this opportunity to thank all participants again today, all 200 of you, for joining us for this weekly session on the COVID-19. As Bruce mentioned, next week we'll have an update on the ACT-A, but also, of course, as the first week of every month, as the DG has announced some weeks ago, we will have an update from the co-chairs of the IPPR. So with that, thank you very much again, all the presenters, all the participants, and we shall see you again next week. Have a very good afternoon, evening, and night wherever you are around the world. And thank you very much again, Excellency Minister of Health of Nicaragua, Dr. Marta Reyes Alvarez, for your presentation. Thank you.